relatively new member of the team. So, hi, Brenda.
Hi.
So tell us again the different certifications you've done with the LMT and what LMT is and so on.
Licensed massage therapist, and it's good to say licensed because there's a lot of different places that are not credentialed and they're getting in trouble. Anyway, we have to get our CEUs through the years, and I've been a licensed massage therapist for the last 10 years. And I was injured. I had lower back, lower lumbar, bulging disc, and instead of going through the medical way that they wanted me to do, take many painkillers and different things, pills, not pillars, pills, I didn't want to take that approach. I wanted a more natural approach, so I decided to learn about my own healing and went to massage school so that I could take control of that myself.
And as the CEUs, you've added to that knowledge, the basic knowledge.
Yes.
What kinds of additional certifications have you done?
Well, one is Thai yoga, body work, where a lot of people are doing yoga, and I help them do positions that they would never be able to do on their own to help loosen the pelvic alignment. And my favorite is myoskeletal alignment, which was trained in, I'm allowed to say the doctor's name, but Eric Dalton. And I feel like I'm very new to this, but it's a lifelong research of helping people.
So, okay, what's special about that technique?
That technique, it's kind of similar under
Say the
Idle
name of the technique.
It is myoskeletal alignment, myofascial release. Some people might know it by that. It's more than just deep tissue. It's lining the spine up where it creates the hips and the pelvic to be lined up, so that one foot's not off, and so that creates a whole schism in the spine. So just getting the muscles and the ligaments attached correctly so that the whole body lines up the way it's supposed to.
Okay. And what other techniques have you?
What other techniques?
We'll break them down further in a little bit.
Okay. Let me think. What is some other techniques that I've taken? Well, I've taken hot stone therapy, which I'm not impressed with that too much. It's kind of a spa modality that they enjoy doing. Let me think. Deeper into deep tissue, which in trigger points, if you do deep tissue before warming up the body, you can do a lot of damage and bruising. So you always want to warm the fascia before you go in deeper to do trigger point. And a lot of therapists go in and just attack with deep tissue and bruise people.
That's interesting. Okay, so your technique would be to warm the body first, and how do you do that?
Just going in with light massage and warming, because you can go deeper into the fascia. And then it goes to the point where it's warmed up, where you can actually go in and release trigger points.
I see. Good. So you avoid damaging.
Yes.
Yeah. What kind of damage would that cause?
Well,
going in without doing the warm.
If you don't warm it up, you can set off a lot of different issues in the body, especially if the trigger point's been there for many years. And I don't think a lot of people read the part where it says to warm up, and they just go in and attack a trigger point. And I've heard many reports from people how it's hurt them, and they think it's natural to have bruising or to be sore for weeks, or different things, and it's really concerning.
Okay. All right. So you're very medically focused.
Yes.
I can see that, and I did see that.
That's
why you're part of us. But the deep tissue technique, can you describe that? What is deep tissue technique?
Deep tissue is going to the deepest part of the fascia, which is you're going into the muscles, and you're going as deep as you can to release, because there's a lot of tightness and a lot of pain, and people don't realize you have the veins, you have the different things that are going on, and if you just rush in to release without them knowing anything and not educating what's happening, there's a lot of confusion. And so I've studied where when you look at the fascia in the skin deeply. You see the epidermis and the different layers
Mhm.
that you are going into.
Mhm.
And so it's very knowledgeable muscles. And oh my goodness, that just brought a memory of one of my teachers. We were studying muscles for so many months, and I got very frustrated. And she said, "You'll thank me one day." And I absolutely thank her, because the muscles, knowing the attachments and where everything is connected, is so vital to getting healing.
Mhm. Good point. And that helps in doing some other techniques as well,
Yes.
knowing exactly where to go.
Yes.
So you talked about pressure points or trigger points,
Yes.
is what you said. Tell me about trigger points. What does that mean?
When I go into people's bodies, especially the neck, where a lot of people have a lot of issues, sometimes it's not in the neck.
Mhm.
And I can find it in the trapezius muscle, or I can find it in different areas as
Mhm.
I'm looking for the origin of the trigger point. And a lot of times they travel in satellite points.
Mhm.
You can get one trigger point and then it'll hide somewhere else.
Mhm.
And that's where the warming up really comes in, to release the full trigger point area. It's like a blockage, is what, it's like it's blocked in that area. And so the blood flow and the different flows are blocked from trigger points, what I've experienced.
Mm.
And when you open and release that, it seems like it has freer, for the blood to go into the area to heal it.
It has freer what?
Freer, it takes the inflammation away. It seems to help the inflammation not to be stored just in that area.
Oh, okay. Mm-hmm. Yeah. So you're dispersing the inflammation.
Yes.
Okay. Sounds interesting. So let's go back to the technique again. You were mentioning of the
Myoskeletal.
Yeah, myoskeletal.
Myoskeletal.
Talk about that. What is that? What's the breakdown of that? What parts of that do you use?
Well, it's involved, a lot of stretching is involved in it.
Mhm.
And instead of just directly going in with your elbow or your forearm, you're actually pulling parts of the body to straighten out the spine.
Mhm.
And so you go around and loosen trigger points, and then you're able to work in isolated areas to help release it. And it's beautiful. It's just a very incredible technique that I've learned. And like I said, it's much studied because it's very fascinating to release the spine.
Mhm. When you say you release the spine, what do you mean by that?
Well, a lot of areas in the neck, like I said, a lot of people have upper body or lower body issues.
Mhm.
To be able to stretch the leg across the hip in a form where it's tight, and then the muscles, the IT band, the piriformis, different issues get locked.
Mhm.
And when you're able to see the movement when you stretch, you're able to see where it's,
Where it's been locked up?
yes, and then able to loosen the area, and then to have a better release than in just plain deep tissue.
Okay. What does it do to the vertebra?
It
along
helps.
the skull?
It just helps to loosen the muscles along the sides, and then you have the muscles that go and protect the spine. And so you're just loosening and helping it to elongate. And
Elongate the spine?
Yes, so that the blood flow is better in the spine.
Mhm.
And then your own body starts its own healing a lot quicker.
Mhm. What kinds of issues would that be a good technique for?
The piriformis, people's hips, the running,
the muscles,
mobility,
yeah.
the hips kind of, you can have one foot going to the right or inverted in. And so it loosens the muscles that they might have had it for their whole life. It could have,
Tightness, you mean?
they could have been walking like that for many, many years and not even realize that they've had an issue until later on when they, it starts causing lower back pain and different things.
Okay. All right. So I heard you say something about using your elbow earlier.
Yes.
So you would stick your elbow in somebody?
Well, I've done my thumbs, my
Not
hands,
just nudging them?
everything, not just nudging. But I've learned to use my own body and my own, so that I'm not hurting myself Usually 8 years is a normal massage therapist's life because they injure parts of their body in fixing people. So it's good to learn different techniques to help yourself as you're working on people. So you're getting adjusted also as you're working on other people.
Right.
So if I take my elbow and I just kind of put it, you know, at the top of the glute, I can find immediately if there's nerves,
Mm-hmm.
you know, the body will start, that neurotransmitters will start flaring so that I see there's a nerve issue going on. And so,
What do you see? You see pulsations or vibrations or?
well, you can, it's almost an electricity that will stem from the lower back into the glutes because it will go and it's trapped and then it goes down into the feet, into the toes.
Mm-hmm.
And so if I see that going on, then I know there's a nerve situation. And so I can go in and get blood flow to the area and it'll start healing on its own just from getting that kind of work done. Where people have had back surgery, they've had different things and they still have the same issue that was never addressed. So they come in worse than what they were when they came in.
Highest paid profession in medicine is back surgeons. On average, $800,000 a year. And a lot of it's based on fusion surgery, which is pathetically documented in terms of research. Very, very poor results in back fusion. And yet it's still one of the largest performed operations. It's horrible.
Yeah.
You know, some of the surgery this time. Now, yes, there are some successful ones, but a lot of the back surgery just doesn't work out very well. So, yeah, so the original cause wasn't addressed,
Right.
but they did surgery anyway. I don't, you know, okay. Anyway, we'll leave that alone because we don't know enough about that specific case, but
It's been many cases.
would this kind of thing help with, say, spinal stenosis or?
I would have to study more in what's going on with that to
Yeah.
know.
In terms of like narrowing of the spinal column, you know, so that you're basically squeezing off.
You know, you're
the
going
flow.
into out of my scope. I have
Yeah,
to
okay.
definitely know
All right.
more in
Pushing it a little bit
that.
more.
It's a very good though, a professional who knows what, you know, will never steer you wrong.
Thank you.
So, okay. What are the other techniques that you learned just in the basics of massage?
And they cover many different things. They cover craniosacral, they cover sports massage, which I love sports massage, working on the sports person who is tight muscles and they get so bulked up and they can't barely move because they become, you know, extremely tight and they're afraid of getting massages. I don't know why. There's a mind thought that, you know, in different areas, and if they realize that massage therapy, it should be muscle therapy is what I'd love to hear the term, because you're actually working with the muscle. And so many things that I've experienced in this profession, you know, and sports massage, deep tissue, just, you know, we learned many
You also did this spa-like stuff too, right?
spa, like that's not my favorite.
Sort
I
of
mean, yeah, because people, even when you're working in the spa,
Relaxation massage.
there's never, they always want you to fix an
Right.
area. They want you to
Yeah.
do a miracle at that point in time.
Mhm. Yeah, so the medical approach and the medical application of it is really valuable.
Yes.
Okay. So what are some of the techniques you use in doing massage? Like, say, you know, there's the pounding and there's the, you know, the moving of the hands up and down
Effleurage.
Okay, and all those things. What are they called and what are they?
Okay,
Describe
that's funny. Effleurage is just the long strokes, the warming up strokes. And then you have the percussion, which really wakens up the nervous system. We don't use that a lot unless we're going to the end of the massage to kind of, you know, say it's getting close to the end, kind of at the 4th of July, you do all the fireworks.
Okay.
There is a point in it though, definitely. You know, you can feel it, especially if I do reflexology on the feet. They say that, you know, if your feet don't feel good, your whole body doesn't, because there's a lot of nerves in the feet that run all the way up to the brain, and it helps open up the pathways. And yeah, so, and even in my Thai work and different things like that, I do a little bit of percussion and different things to just see how fluidly the body responds. I can find people's defense mechanisms. Sometimes they laugh, or they have different, they might cry, or they might start talking about different things that happened in their life. So it becomes a whole therapy session, which is not my scope. So I just kind of listen and don't tell them,
You don't advise.
No, just listen to them. And women that are pregnant, massage really helps them a lot. A lot of times they feel alone, and their husbands don't understand what's going on with them. And so a lot of times when you have a massage therapist in that, after the first trimester, it really helps calm them down and relieve a lot of their fears, especially first-time moms. It helps them, especially with lower back issues and the change of the pelvic that's going on.
Okay, but there's precautionary stuff about working with pregnant women.
And trigger points that you don't want to touch.
Right.
And in the first trimester, you don't really want to work on them.
Like between the thumb and the forefinger?
Well, above the ankle, you can actually induce labor.
Finger. Above the ankle?
Yes, the inside of the ankle.
There are some spots. Okay, well, let's take a little break, and then I'll ask you to tell me more about this Thai yoga massage stuff. So you're listening to A Path to Wellness on WSPF Digital Broadcasting, rhinoanair.com, and we'll talk to you in a few minutes. before the break about Thai yoga
body work.
and body work. And so what do they use? A lot of curry? Is that why it's Thai?
I actually learned under Barry Cooper. I hope that's a good plug for him. We were volunteering at, I put names in. Anyway, they were having college football players on the beach, trade winds. We were doing complimentary massages for the college football players that were coming in to get picked by the NFL. And some of them never had any massages. And I caught Mr. Barry standing on their lower back. And I thought, that's incredible, because there's been many, very muscular men who want really deep tissue. And I'm doing everything I can, even put my feet up against the wall to put in all my body weight to help. And it's still, they can't feel it. So learning Thai yoga has saved my hands. I've been able to use my feet.
Mm-hmm.
And then I'm able to go in and do the stretches that I couldn't do on a table.
Mm-hmm.
And where it becomes more sports approach, where that, it's not uncomfortable or anything, and you're able to get the areas, and they're, they stretch and they work out and they're tough and they're strong, but they need somebody that's stronger to do that. And me as a woman, I've not been as strong, and so a lot of the guys will not go to a female because they think it's strange or whatever, but they need to realize that the man has the strength most of the time, unless you start, lifting weights and different things like that. It's not going to do what they really need until you do the Thai yoga body work, where you can actually use your legs are the stronger part of your body, so you can use the strength of your legs to go
your
in
legs
and
are
do
stronger
it.
muscles, yeah.
Yes.
And how do you move the tissue with your feet?
Well,
you're using your feet kind of like a monkey does, just kind of squeeze.
kind of maybe. Well, you're getting them on the floor on the mat, and you're able to warm them up in a Thai where you're waking up the different meridian paths. And you're able to grab their hip and their leg with your feet and stretch them and open up their hip where they can actually be more flexible, and helps them to do a better job in their sports practice and getting them to do their kicks if they need to do better kicks. Barry is amazing, and that's why I wanted to learn under him. And if anybody's listening, Barry Cooper. Yeah.
What was the name of the guy that taught you the other technique again?
Eric Dalton.
Eric Dalton.
Dalton, Dalton. Fabulous.
Did you go to a seminar in Florida? Or?
Actually, I've been pulling him up since 2009. A friend of mine introduced me to him, and I've been watching. You can watch his techniques on YouTube and different things like that. So I had issues, and I went home to do a little research. What was the best? He always showed up on my Google search or whatever, and so I became more fascinated with his approach. And finally, I did take a class from him, and they do online training, and I need to actually go under him to get what I want. But you still can learn from watching.
So there's further certifications.
There's further much further.
But he gives you certifications at different levels.
Absolutely.
I see. Interesting. Now, you were up in, I guess, Maryland for a while?
Yeah, that's how I learned a lot of, up in St. Mary's County, they do a lot of holistic and natural approach where they respect it. They seem a lot more knowledgeable with different healing techniques.
Yeah, I know there's a pretty good school up there. It's called Thai Sophia. Have you heard of it?
No.
Yeah,
I went to school up there also. That's where I started, in Baltimore.
Mm-hmm. Yeah. I've driven around the Baltimore area. I think they have a lot of hilly areas.
Maryland's just beautiful. By the water, it's not as hilly.
In the winter, sliding down the hills as you try to get back up the next one.
It's beautiful. The DC area, very nice.
Okay, so one more time on what that technique is called.
The Thai yoga or the
Yeah.
myofascial alignment.
Myofascial alignment.
Yes, it's kind of under the same item. Rolf, who does Rolfing,
Oh, okay.
but it's not as painful.
So tell us about Rolfing.
Well, I've not trained. I've experienced
Okay.
some sessions, and I've been reading and studying. just because my intentions, I don't ever want to hurt anybody. So it's a stronger modality that's incredible. But Ida Mae Rolfe was an amazing woman who really believed in Rolfing.
Mhm. Well, what is Rolfing?
Rolfing is alignment. It's aligning everything up with the spine also, but they go into a 10-session, call me, quote me if I'm wrong, 10 sessions where they go from head to toe to open up every pathway of the body to get more freedom, more movement. People who have severe degenerative, they're frozen up all through their whole body, can definitely benefit just from a couple sessions, but you want to do 10 to go through the whole body to get that completed.
You ever done any Reiki?
I have read and trained some. I have not become certified, but you actually go into energy healing when you are working on people. And especially if they have good energy, you pick up on that. So a whole healing session happens, accidentally sometimes.
Yeah, and for those who don't, maybe don't understand the energy aspect of it and maybe are a little skeptical about that part. First of all, let me put in something that
Yes.
you put in your explanation, but we got to realize that we're electromagnetic beings. We're surrounded by electromagnetic energy. The electromagnetic field around each of our bodies is what drives a lot of the processes that go on in our bodies. Conventional medicine doesn't address that. It's all about the chemistry of it and the chemical processes and cell splitting and these kinds of processes that go on. But what drives those is the physics. It's the electromagnetic energy that we have in our bodies. This is part of what we're sensing when we talk about energy in the body, right?
Yes.
And I know that Reiki is derived from something called medical Qigong, which is something that I've studied a little bit. And I know that when I was doing the medical Qigong, I really could feel that energy. And there was a certain threshold I would go past and I'd really feel it more intensely, So what's your experience with that?
My experience, I've studied and trained healing from different areas because I always wanted to see people get better my whole life. I guess I was born an empath, with my mother. And so I became very curious and being surrounded by people who had different issues. And I realized that we are a spirit being in a house. And our body's kind of like the house that facilitates who we really are. And a lot of times when we're injured or something happens, we use different parts of our body or different parts of our person to make up for the area that's injured.
Yeah, guarding.
Yes. So I find that is what happens. And so people who get weirded off by energy and healings, they don't understand, and they'd rather shut that off and not grow to become more educated in the healing process that is available. And a lot of the pharmaceutical issues keep those parts of the body from healing, and they go back reverse.
That's an interesting point. Yeah. So, if you're numbing a certain area of the body, it may not respond like it would naturally.
Right.
Yeah. And certainly in terms of healing.
Right.
So you may be improving the signs and symptoms,
The root.
but you haven't gotten to the cause, right? The root cause. And you're right. That's you're obviously pointing out to or alluding to the fact that at Wellness, our primary focus is on the underlying cause of disorders, not just the symptoms. In fact, a lot of patients come in and they're a little confused because when they come in, they say they're anxious.
Yeah.
I'm not immediately giving them anti-anxiety herbs.
Right.
I may look through blood work or some other testing to find what's going on that's out of balance for them or deficiencies, for example, and then address those. And it may be a few weeks to go that route to address them, but I'm actually addressing the cause,
Right.
and eventually when those deficiencies are addressed, then they get better.
Yes.
The anxiety just goes away. So a lot better approach, I think, than a Xanax.
Yes. What did you say Xanax did? You explained to me, because we get a lot of women that are running out of their Xanax and they need.
Yeah, well, Xanax is an anti-anxiety drug, and there is a side effect for a lot of women that they can have seizures. Yeah, and I did have a patient who had a seizure where she suddenly fell to the ground, smashed her head, had to have a lot of surgery in her face and so on after she had taken the Xanax. Yeah. So it's not, I don't know anyone who has a Xanax deficiency, right?
Right, correct.
That's what it comes down to, I'm trying to figure out where the issues are that might be leading to that anxiety. And they can be involved in many things. They can be involved in, for example, not being able to transport oxygen enough in your body. That can be from things like insulin resistance, where you're getting too much insulin produced, and the insulin reduces the oxygen transfer from the bloodstream into the muscles and into your body. So your body's not getting enough oxygen. Well, if your brain doesn't get enough oxygen, it puts out an APB to the rest of your body, basically. Need air, you're gonna get anxious. And the same with sugar. If you're getting low on sugar, you can get really strong anxiety. There can be a thyroid disorder leading to anxiety, and for similar reasons. The thyroid being dysfunctional is affecting the body in similar ways. And it can be even lacking in iron, because you're not making enough red blood cells, therefore you don't have enough oxygen carrying capacity to the brain. So these kinds of things are true root causes.
Absolutely.
You see?
Mm-hmm.
So that kind of thing. Now, yes, there are herbs. There's a lot of herbs, and sometimes I will use those to treat the symptoms while focusing on getting to the underlying cause, depending on the individual.
Well, you said something about air and breathing, and I watch a lot of people that have their trapezius muscles up to their ears.
Oh yeah.
They're in survival mode.
Right.
And they're
Get
not
really
really,
tense.
yes, they're not breathing from the diaphragm, so they're not able to relax. So they're continually in defense mode all the time. And
Right.
see many people walking around like that.
Yeah. It's a very tense way to be.
Yes.
And some of it can be simply from their job, even just crouching all day. If somebody's, say, an accountant and they do all paperwork, desk work, and they're crouching over this paperwork all day long, their muscles get kind of stuck in a certain position, right? And that adds tension to their body, can be pulling on the bottom of their cranium, on the bottom of their head, the muscles up in there.
I see them.
Yeah, the sternocleidomastoid, sure, the
Scaling.
scalenes, that's what I was looking for, all of those, yeah. And putting pressure on the head, so they end up with headaches, tension headaches, all these kind of things.
Mm-hmm. So many issues, isn't there? That just
Right, and that's sort of a difference with holistic approaches versus the conventional approach that's just kind of looking at each piece as a part of a machine and, not really looking at the integrated whole.
correct.
And part of why I promote the idea of integrative medicine, where, there are definite benefits to conventional approaches,
Mm-hmm.
but conventional medicine is primarily designed around emergency medicine. And, the drugs are just kind of transplanted over from emergency care to chronic care, but they don't necessarily work well for chronic issues, because continually poisoning somebody for a chronic disorder means that you're causing damage to their body. And that's a lot of what we see, like overuse of even over-the-counter drugs like NSAIDs, non-steroidal anti-inflammatory drugs. I had a kid who was a basketball player come into my office years ago, and he was coughing up blood.
Wow.
And that's what it turned out to be, was long-term use of NSAIDs, Tylenol, that kind of stuff. And he had done a lot of damage to his gastrointestinal tract. And it was a mess. So. Anyway.
We definitely need to hear more of these kind of treatments and help that is available. I'm sure there are doctors that really have a heart, they would never have gone into medicine if they didn't care
Right.
about people. Well, hopefully that's the intent.
A lot of them, yeah. For sure. I think a lot of people go into medicine just basically because they want to help people.
Mhm.
But there are a lot of different approaches to that. And there are actually many different systems, complete systems of medicine. Like, it's not just conventional medicine with the chemical basis, the refined chemicals and drugs. But, for example, Ayurvedic medicine is an older one from India. There's traditional Chinese medicine. There's naturopathic medicine. There's Thai medicine, which includes some of what you were talking about. There's Tibetan herbal medicine mostly, but they have a complete system. They do diagnostics and various kinds of testing and all of these different systems. They're looking at body systems. They're looking at things like pulses and tongue analyses, and in some cases, like with naturopathy, they're one of the more non-conventional types, non-Western mode.
Eastern.
Not even Eastern. What is it? Sort of traditional naturopathy uses iridology, looking at the eyes and looking for patterns or blotches in the eyes that indicate some dysfunction in certain parts of the body. In a similar way to reflexology, right? Where you can be on somebody's foot and treat their neck.
Right. But we also have medicine and chemicals in our own body that just even by thought process creates negative or positive chemistry.
Exactly, yeah. Enkephalins, endorphins, our own opiates, endogenous opiates. That's actually part of what acupuncture stimulates, is the production of endogenous opiates. In other words, opiate forms of naturally occurring chemicals in the body can be stimulated by the use of acupuncture. So why does somebody need an oxycodone or morphine when
Takes it
your body
immediately.
can produce it?
Yeah, they don't realize that's where the education comes in, to realize, because even in the pleasure centers in the brain, a lot of addictions are formed because they have that first reflex of pleasure. And when they realize that they don't have to take certain drugs to cause that pleasure or that healing to happen, and they're just taught to take the pill or go to a more different clinic to treat another addiction to get better. And it's a continual chasing your tail kind of cycle is what I think.
Yeah. Now, of course, when we're talking about this, we're not trying to treat, cure, or prevent disease. We're trying to get the information out there about other options, and that there are other options. And I think that in a lot of people in the holistic medicine sort of see, I've heard this from a few people, sort of see conventional medicine as the alternative medicine.
Wow.
And really it is in a lot of ways, because 80 to 85%, I believe it's 85% of the medicine, the primary care form of medicine that's practiced is actually natural medicine around the world. 80 to 85% of it is the natural medicine. It's only about 15% of the medicine practiced around the world is more of the conventional route. So
Like valerian root
That
would be Valiums. I mean, how?
no.
No.
No,
Okay,
they're
no,
not.
just
They're not
thinking of the
related.
natural. Okay.
They're not related. But no, I mean, natural medicine practiced, all the different forms that I just mentioned, is practiced around the world as primary care. And that's the primary form of primary care medicine practiced in the world, is natural medicine.
Okay.
So people in the US kind of view it as an alternative, and therefore the term alternative medicine. But in point of fact, the alternative is really conventional medicine.
From the other part of the world.
In most of the world,
Yeah.
So and that's kind of last resort medicine for a lot of people in the world. I kind of experienced a lot of this in Australia, and I think that's true for a large part of the world.
Like even with reflexology, I learned from Chinese people, from actual Chinese that taught me after I learned in school how to do reflexology. And then there's the Western philosophy and then the Eastern philosophy.
There's a Western school of reflexology that actually is headquartered in St. Petersburg, Florida.
Oh, wow.
That's right.
And not to put it down or anything, because there's, people have different ways of how they do things.
Right.
But the Chinese, with their reflexology, they're very believing that it's going to heal, which I'm sure with the Western and
Right.
also. But their technique is a little more aggressive than the
Yeah.
Western.
Chinese do, like, even with acupuncture, you don't practice acupuncture in the US the way that it's practiced in China, because you wouldn't keep anyone as a patient.
Right.
Because there's literally, they do, they're very, very strong in the way they use the needles, very, it can be sort of it can be painful, but also it can really jar people,
Right.
because there's a real reflex, real sort of
Reaction to what's
it's a strong form of the therapy. Whereas most acupuncture in the U.S. anyway is practiced more gently, and there are other schools of thought on that. Like Japanese acupuncture typically is very light, and you don't really feel a lot. So there's a lot of ways it can be done. That's just another example. And in Florida, the practice of natural medicine is pretty much restricted to being licensed in Oriental medicine. And then, if you have a background in other areas, you can kind of bring that into the whole scope of it, because there is a wide scope for people who are practicing in that area. And so that's part of what I do. I take in the naturopathic background I have and kind of bring that into the way I approach things, as well as the Oriental medicine, to get a more full scope kind of response.
Why do you think that a lot of the women are having issues with fertility and different things like that?
That came out of nowhere. Why? Okay, why? Lots of reasons, but a lot of it is hormonal imbalance.
Uh-huh.
Most of it is hormonal imbalance. In some cases, there are genetic issues. In some cases, there are blockages in the woman, like, for example, in the fallopian tubes.
Mm-hmm.
There can be a blockage. And then sometimes it's the guy that has a blockage.
Mm-hmm.
You can have a varicocele or other kinds of problems that block the flow of sperm.
Mm-hmm.
So, and we've seen some examples of that in the practice. Most recently, one of my couples I was working with had this issue where it was actually the guy in that case, and he had a blockage.
Mm-hmm.
And the blockage was opened up by using an herbal formula that I had him take. I expected it to take about 4 or 5 months for the blockage to open up, and then we'd start working on, okay, let's get them pregnant. Well, it took 6 weeks and they were pregnant. So I was impressed with that.
Right. That's what I'm finding fascinating. Women that are trying to have a family and
Mm-hmm.
they don't know what to do. So
Yeah.
I find that very
And they're
fascinating.
going for IVF with really overpowering treatments that can damage their bodies, and paying, $20,000 a shot, and have less than a 1 in 5 chance of being successful, and throwing a lot of money into becoming pregnant, when there are more natural approaches that work with your body, are like a fraction of the cost, and actually make you feel good at the same time, and healthier, and in a more healthy approach to being fertile, and that lasts the rest of their life.
Mm-hmm.
So there's a lot to gain by going more natural.
Right.
And we've had about, in the last 2-3 months, we've had like 5 pregnancies.
It's amazing. You should have them to talk and share what they've gone through, actually.
Yeah.
But even with hysterectomies, I meet many young women that have had hysterectomies.
That's crazy.
Yeah, and they have no
And it's
hope.
so often unnecessary. Yeah. In fact, the CDC's talked about, Centers for Disease Control has talked about how many of those are unnecessary.
So I'm learning a lot, being educated myself from the natural aspect.
And you've seen a lot in the practice,
Yes,
what's going on.
yes, and I'm very fascinated and want to learn more. So good. Nice. Thank you.
Well, thank you for being on the show. So we learned more.
Yeah.
All right, so you've been listening to A Path to Wellness on WSPF Digital Broadcasting, rhinoonair.com. If you'd like to get a hold of us at the practice, you can call us at 727-329-9637, or you can take a look at the website at www.aptw.net, which is short for A Path to Wellness, aptw.net.
And they can hear you on Fridays.
And also,
on
you
Friday.
can listen to us again as we rebroadcast on Fab Radio International out of Manchester, England, tomorrow morning at 10 o'clock, I believe it is.
It's 10 a.m. Eastern
10
Standard.
a.m. Eastern Standard, yeah. So, thanks for listening.
Thank you.
Sorry.
I hope I did okay. I was kind of
Oh, you're fine.
recording on the spot trying to.
That's how it is.